to start with a very basic topic. That's the anatomy of the PCL. The PCL, as we know, is one of the main central stabilizers of the knee joint. It's an intra-articular structure. It is also extra synovial, as it is covered by the synovium. We all know the PCL originates from the anterolateral aspect of the medial condyle of the femur within the notch, and it inserts onto the posterior aspect of the tibial plateau, approximately 1 centimeter distal to the joint line. On an average, the length of the PCL is about 32 to 38 millimeters with an average cross-section of approximately 11 to 13 millimeters. PCL is also the strongest ligament of the knee joint and has a maximum tensile load of 739 to 1,627 newtons. The average surface area of the PCL attachments on the femur is about 209 millimeters square, and on the tibial footprint is about 243 millimeters square. As a result, the insertional sites are roughly 3 times larger than its width substance. The PCL consists of 2 functional bundles. The larger one is called the anterolateral bundle, and the smaller, the posterior medial bundle. Arthroscopically, Dr. Laprade and his team have found distinct osseous morphology on the distal articular margin as well as the condylar notch. And there are 3 distinct points that are available along the distal articular margin. The first one is the trochlea point, which is the highest point on the distal articular margin. As you keep coming down from the highest or the trochlea point, the cartilage begins to, as it comes down more posteromedially, it starts straightening out, and that the central part of that is called as the medial arch point. And continuing along the articular cartilage edge, the most posterior extent of the cartilage margin of the medial femoral condyle is termed as the posterior point. There are 3 distinct osseous landmarks also on the medial condyle. The first one is the medial intercondylar ridge. This constitutes the proximal borders of both the bundles, the anterolateral and the posteromedial bundles. There's a medial bifurcate ridge on the medial condyle, which marks the separation between the anterolateral and the posteromedial bundles. A palpable and a visible osseous prominence is always present adjacent to the medial intercondylar ridge at the separation of the anterolateral bundles, and it is called the medial bifurcate prominence. There are certain anatomic landmarks on the tibia which indicate the anatomical sites for the PCL. The attachment is located below the articular surface of the tibia in a sulcus between 2 osseous prominences, which are the posterior aspect of both the medial and the lateral tibial condyles. This sulcus is called the PCL facet. The PCL tibial footprint is divided into 2 planes by a horizontal ridge, which is called as the bundle ridge. The lateral limit of the bundle ridge, the articular cartilage of the lateral tibial plateau, exhibits an abrupt dislolateral turn termed as a lateral articular point. The posterior aspect of the posterior horn of the medial meniscus has something called as shiny white fibers, which are anteromedial to the anterolateral bundle. The distal lateral corner of these fibers is another point called as the shiny white fiber point. The medial side of the PCL is bordered by the osseous wall descending distal to the medial tibial plateau, and it is called as medial groove. The distal portion, the distal border of the PCL is often described relative to the prominent ridge at the posterior aspect of the tibial plateau, and it is called the champagne glass drop-off, and that is the distal border of the posteromedial border. Keeping all these anatomical landmarks in mind, the anterolateral bundle's classic anatomy is like this. The area of the bundle is between 112 to 118 millimeters square. The center of the femoral aspect of the anterolateral bundle footprint is about 7.4 millimeter from the trochlea point, 11 millimeters from the medial arch point, and 7.9 millimeters from the distal articular cartilage. And its tibial attachment is located 6.1 millimeters posterior to the shiny white fibers of the posterior medial meniscus root, 4.9 millimeters from the bundle ridge, and 10.7 millimeters from the champagne glass drop-off. The posterior medial bundle, the area lies between about 60 to 90 millimeters square in size. It is located between the anterior and posterior meniscofemoral ligaments. The femoral footprint is the center of which is located 11 millimeters from the medial arch point and 10.8 millimeters from the posterior point of the articular cartilage margin. The tibial attachment is located 4.4 millimeter anterior to the champagne glass drop-off and 3.1 lateral from the medial groove of the medial tibial plateau. So this diagram indicates the footprints of the femoral footprint of the anterolateral bundle and the posteromedial bundle and its center point from different osseous and cartilage points. And the picture below is on the tibial footprint. Another two important ligaments that accompany the PCL are the meniscofemoral ligament, the anterior meniscofemoral ligament, or the ligament of Humphrey, which slants across the distal aspect of the PCL in the flexed knee. It is attached on the distal aspect of the PCL on the femur and is very superficial. Its distal attachment is to the posterior horn of the lateral meniscus. The posterior meniscofemoral ligament or the ligament of Risberg, this extends from the medial wall of the femoral intercondylar notch and the posterior horn of the lateral meniscus. The femoral attachment is proximal to the posteromedial fibers of the PCL and it is superficial to the PCL when viewed from the posterior aspect. Thank you.